I am Susanna Copeland, and I'm so excited to share with you the spaces we have at Atlantic to serve you better. As you enter the practice, you'll come into the patient care coordination area. These are the smiling faces that will greet you when you come in for your appointments. You'll already have touched base with them when you've made your appointment for your new patient visit. They assist with scheduling, medical records requests, and can coordinate all of your interfaces with the practice. Next to our patient care coordination area is our financial department. This is an area that we've recently expanded to allow a quality space for communication. There's an area where you can meet one-on-one with a financial coordinator if you prefer an inpatient visit. There also is an area where they will be providing virtual visits, so you don't have to drive to the practice to communicate with our financial department. This is a shared area, so they can collaborate to serve you better. As we come down the hall, you'll see our reception area where you can grab coffee and tea before you enter the nerve center of the practice, which is where ultrasounds, blood draws, intrauterine inseminations, procedures are performed. In this space, you'll be greeted by our warm medical assistant care team. They will take you to where your procedures will be, explain the process, and they're here to help bring any anxiety down. This is also where you'll meet with your provider staff for new patient visits and in-office returns. We appreciate if you come to the office for your new patient visit so that you get a chance to see us live and in person. Future visits, return visits, we are happy to offer virtual, but that first connection we do like to be in person if it's at all possible for you to do so. As we enter the area of the central part of this clinical area, you will see our medical assistants. Note that we create spaces where people can collaborate. So this is where they can make high-quality handoffs on helping one patient, transitioning to another patient, really helping us flow you through the practice so your morning visits for monitoring and for blood draw will go smoothly. As we enter our nursing area, it's a larger space for the many nurses who are helping to guide your journey. Some of your interactions with our nurses will be in person when you come in for certain procedures that require anesthesia. Some will be in a virtual environment, but know that they are gathering in this space, communicating with each other on your care. As we go further down the hall, you will see that we will enter the area where our advanced practice providers collaborate. This is a new space that we developed because as our practice has grown, we have recruited wonderful advanced practice providers to assist you in your care. And this is a space where they can collaborate and have handoffs on the different aspects of their day that really help flow your care through the practice. You'll meet with the advanced practice providers for new patient visits, for hysterosalpingograms, for ultrasounds, intrauterine inseminations, endometrial biopsies. They look forward to greeting you. As we exit the clinical space, we'll head over to the lab. Our lab environment was also recently expanded. This allows a larger space for the higher number of embryologists and andrologists that are needed to offer you high-quality, complex laboratory care. This is our andrology space, where our andrologists are working with sperm to do semen analyses and sperm cryopreservations. As we enter the lab space, we took time to develop a larger lab space to serve more patients and address embryology flow so that our embryologists have all the space they need to devote their time to the care of your egg, sperm, and embryos while they are with us. We're entering our cryopreservation area. After your eggs, sperm, or embryos are cryopreserved, they will stay here in our on-site storage facility for the time period that we are actively moving through your care to your first pregnancy. Once you are pregnant, pregnancy is a year and recovery from pregnancy is a year and a half. So during that time period where your embryos are not going to be transferred to you, they go to long-term storage where they will wait to see if you decide to build your family further. Here we are in pre-post-op recovery. This is the space where you will get ready for your procedures, meeting with our caring anesthesia team as they start an IV so that you can have high-quality sedation. Also where you will recover until you are feeling alert enough to have some crackers, some ginger ale, and then transition on to the part of your recovery that will be at home after your procedure. As we enter our procedure rooms, we have 2 procedure rooms. One is primarily for egg retrievals and embryo transfers, and one is primarily for surgical procedures. Dr. Matt Coward has brought his male fertility practice inside Atlantic and has outfit this room with the high-quality microscope required for his surgical procedures. This allows him to offer a process that is not available everywhere called microtesting, allowing us to search for the rarest of sperm to help you build your family further. As we exit the lab area, we go to the diagnostic and executive suite portion of our practice. As Atlantic has grown, we've needed more spaces to serve you. This is a hybrid space. Patients will come to this space for a very private area for sperm collection, away from the busy atmosphere of the other parts of our practice. We also have our hysterosalpingogram suite here, which is where we can diagnostically test to see if fallopian tubes are open. This is also a space where nurses can meet with patients for education, or you'll note that this is a space where they're in the virtual sphere meeting with you for their education, but this is the room where they can have a quiet space to dedicate all of their attention to your teaching. Many of our spaces at Atlantic are dedicated to your clinical care. We also honor that this is a journey that has an emotional burden. So in our new suite, we have incorporated a mental health room where you can meet with a reproductive psychologist to discuss how to lift the burden, the emotional burden of fertility treatment while you're on your path to your family. The other part of our new space is our executive suite. As Atlantic has grown, we need more spaces for high-quality communication and program development. We want to serve all the patients who wish to be served by Atlantic, and therefore our management team meets in this space to collaborate on program development, optimize patient care, optimize experience of care, and optimize experience of caring for our staff. This is our new and larger conference room. It's a Teams room, so if you're ever doing a virtual meeting with a larger number of members of staff, you may note that we look amazing on camera because we have a Teams room that allows us to interface with other collaborators around the country to talk about how we can optimize your experience of care within the practice. It's also where we have our in vitro fertilization meetings, where each and every patient who is on an IVF journey's care is discussed with a full complement of our nurses, providers, laboratory staff, financial team. In this way, we can offer you coordinated care. Welcome to our break room. It's a larger space to be able to accommodate the larger staff that we have grown over time to be able to serve your needs. We use the space in many ways. For lunch, for educational formats like cookies and concepts, where our team members who've traveled to meetings bring back what they learned so we can all learn together. We use it for our quarterly staff meetings. We also have after-work gatherings to allow us to coalesce as a team and collaborate on fun activities like bingo or potted plants. And that atmosphere where we gather together to unite as a community translates out into your care, into the practice, because you meet with a team that enjoys working together and serving your fertility journey.